Hi, vomiting is probably the most common issue what most parents face while feeding their child. Is that something to be worried about? Maybe no. On most occasions, it's regurgitation, where milk flows out of stomach effortlessly, whereas vomiting is painful, it's associated with discomfort. More than half of the babies have regurgitation, as it's effortless, not associated with any pain or discomfort. They're aptly called happy spitters. Why does regurgitation should happen to a baby? Because the stomach capacity is very small. That's roughly about 30 ml per kilo. For instance, if your baby is 5 kilos, the stomach capacity is 150 ml. Only 2/3 of that has to be filled up, not the entire 150 ml can be filled up. If you tend to push a little more than what can be accommodated, all that comes out. Aerophagia is ingestion of air along with the milk. This happens in almost all the babies. When they take breast milk, the corners of the mouth allows a lot of air, which can result in distension of the stomach and the babies throw up a bit. Aerophagia can also happen with bottle feeding or even usage of pacifiers. Burping is done by most parents. Some babies burp, some babies don't. When babies don't burp, they keep patting their babies all the time, they jiggle babies all the time. That can result in vomiting. At last is the lower esophageal sphincter. What's this? When we take the food, it goes to the esophagus, stomach, and then to the intestine. It doesn't come back. It is because it's held by a lower esophageal sphincter, which is a rubber band like thing which allows the one-way transit. Once it goes down, it doesn't come back. Even if you stand upside down, milk just stays there. But in kids, this band is a little lax. It's not as taut as in adults. Some babies have it more lax than other babies. In these babies, when they are made to lie down, milk just comes out effortlessly. As we have understood why this regurgitation happens, should we be really worried about? Maybe not. More than half of the babies have this issue. It reaches a peak by 4 months, gradually starts settling down by next 1 year to 2 years. More than 88% of the babies do settle down in the first year. Once they start sitting, once they start walking, once solid feeds are started, it just settles down. But some babies need much more help than this. In babies who have too frequent vomiting, they need to be made to sleep in a 45 degrees angulation. Instead of babies being made to lie flat, they need to be lifted up even while they are asleep. The most important part of today's discussion: should you reach out to a doctor just because your child has vomit? No. Then when should you be reaching a doctor? When a child is not growing, when your child seems to be in pain, when your child seems to be in discomfort, or when bile, that is the greenish liquid which comes along with the vomit. I think that's high time when you should be reaching a doctor. Thanks for tuning in. Like, subscribe, share, and ask a few questions. I'll definitely answer. Bye-bye.